Are bleeding gums bringing you down? Good thing it's Dental Hygiene Wednesday. Hi, I'm Christina. I'm the lead hygienist here at Dublin Dental Care, and I want to welcome you to our Dental Hygiene Wednesdays. Every week we like to talk about a different product or a different topic that we feel is important for our patients and our viewers to know about so that they can help keep their mouths nice and healthy while they're not here in the office with us. Last week we talked about HPV and how if HPV is something that you have, it does increase the risk of you developing oral cancer and ways that you can kind of stay on top of it and making sure that that is not something that's going on in your mouth. If you missed that, feel free to check that video out. It is on both our Facebook page and also our YouTube page, as well as all of our previous videos we've done in the past. This week we are talking about gingivitis and ways that you can keep gingivitis from being an issue in your mouth. So gingivitis is also considered to be a tissue infection or gum infection. What happens is you notice your tissues right around the gum line start getting a little more red than what they normally are. You might have bleeding with brushing and flossing, which is not normal. And that is something that you need to keep an eye out for. If you are experiencing these things, I have a lot of people come in and they say, you know, I've been flossing and I've been noticing my gums bleeding when I'm flossing, so I stopped flossing because, you know, I felt like I was doing damage to the tissue. Whereas in reality, that's actually the opposite. If you are seeing bleeding in the tissues while you're flossing, it means that the tissues are infected, and that because you're going down and kind of brushing along the gum lines, it's irritating them and causing them to bleed. So it's important that you're flossing every day, if not adding an extra time of flossing into your daily schedule till that bleeding kind of slows down and gets a little better. What that is doing is getting the bacteria out of the tissues so it's not affecting the tissues and not allowing that infection to continue. So another thing that people tend to do, and I see this a lot because I see a lot of plaque buildup right along the gum line on the bottom of the tooth. So most people focus on brushing the teeth, which is, it's a toothbrush, so that's what it's used for. So a lot of times they will just kind of brush the tooth structure in the top, but they forget to brush the tissues. And that's an important thing because we don't want the bacteria to stay on the tissue. We want to make sure we're getting it off the tissue so your tissues can stay healthy. So what we recommend doing is holding your toothbrush at a 45-degree angle so that the bristles are going down underneath the tissues and going back and forth to kind of get that bacteria out of there and allowing your bristles on your toothbrush to go under the gum line and flip the bacteria out of there. So that's something that will help keep your tissues healthy, help keep the bleeding from occurring. Another thing, we talked about floss, making sure you're pulling it tight against the tooth. So I'll show you really quick. Holding it tight against the tooth. I always wrap it around my middle finger so I can use my thumb and index finger to kind of move it. But what you do is you pull it, put it underneath, and then pull it tight so it makes like a C shape, which is easier said than done with one hand. And then going up and down the side of the tooth and underneath the gum tissue. But this C shape, both to the back and to the front, is very important because that means that you're getting not only in between where the teeth are touching, but also along the whole side of the tooth and under the tissue to get that bacteria out of that whole area. Another thing that we recommend using to help with gingivitis and help keep that from occurring are stimulants. If you have any questions about using them or anything like that, feel free to ask when you come in to see us. It's super easy. They are little wooden sticks. It comes in a pack like this. You just break it off. You wet the tip and then you insert it along the gum line to help stimulate that tissue so that your tissues can stay healthy. And so the blood flows up at the top of the tissue to help fight off bacteria as the bacteria gets in the area. So if you use all these tips and you keep your mouth nice and healthy, brush twice a day, floss, use the stimulant, make sure you're brushing your tissues, gingivitis shouldn't be an issue for you. If you do see bleeding, make sure you're really concentrating on flossing, the way you're taking it, going down under the tissues, coming back up, maybe adding the stimulant in if you're not using it right now, and making sure you're brushing the tissues. If you have questions on, am I flossing properly? Am I using the stimulant properly? When you come in, ask. We love to help you out. Make sure that you're doing everything the right way so your mouth's healthy. Our goal is to keep your mouth healthy, so this isn't even a concern for you. So I want to thank you for joining us today. Like always, we love having you guys watch our videos. Feel free to like our video or leave a comment. We love replying and seeing what you guys have to say. If you have any questions for me, feel free to email me. My email address is christina@dublindentalcareohio.com, and check out our website. It's dublindentalcareohio.com. You can even book an appointment from our website to come in and see us. I hope you're having a great week, and we look forward to seeing you next week. Thank you.